My research was on cancer-related fatigue, and fatigue is a really common side effect of cancer treatment. Most patients experience fatigue at some stage during their treatment or afterwards, but for a minority of patients it can continue after they finish treatment, and it can be a very distressing symptom for a lot of patients. My study followed patients from before they started their chemotherapy treatment up until about a year afterwards, and during that time I assessed them or linked in with them about 5 times. Cognitive behavioural therapy, or CBT, is a form of psychological therapy that looks at how people's thoughts, emotions, behaviours and physical symptoms are connected, and how interconnections between these factors can actually contribute to a cycle that helps to prolong symptoms over time. So I evaluated a home-based self-help CBT intervention for patients with cancer-related fatigue. So they completed a manual that was based on CBT therapies at home themselves for their fatigue. And we found that this intervention was really helpful for a lot of patients, so that the patients that actually finished the programme reported that they had lower levels of fatigue afterwards, lower levels of anxiety and distress, and better quality of life. I found that patients who had a greater number of other medical conditions, maybe heart-related conditions or diabetes, that they were at a greater risk of experiencing persistent fatigue from their cancer treatment. And those who engaged in less physical activity were also more likely to experience more severe fatigue after their treatment. So it's very difficult to balance activity levels. It's important not to overdo things, but equally it's important to stay active as well during and after the treatment. It's fortunate that because of improvements in treatment, more and more people are surviving cancer, and that's a really positive thing, but there are a lot of issues that cancer survivors experience on a day-to-day basis after their treatment. And it's really important to provide patients like that with support, because even though their cancer treatment is over, they're still suffering from the effects of that treatment, both psychological and physical. So I think that this area of research can have a really positive effect on people's lives.